Hello, Mike Jones, Fire Chief and Emergency Manager for the City of Fredericksburg, here to provide you a weekly update on the COVID-19 situation in the Rappahannock Area Health District in the City of Fredericksburg. Again, case loads still seem to be fairly high, although we might have reached the peak. We're still averaging about 1,000 new cases a week and averaging just a little bit over around 130, 140 cases per day in the health district. So those numbers are continuing to stay fairly high. The 7-day rolling positivity average in the health district still remains above 11% and almost 12%. We were as high as 13% last week, so we have seen a slight reduction there. But caseloads are still high. The biggest thing we can talk about this week is the fact that the hospitals are full of COVID patients. We know that, and you know that. With the recent town hall done by Mary Washington Healthcare, their system is very much taxed with what they can do. The number of people in the hospital and the number of beds available are dwindling. They, by their own admission, have postponed some surgeries for some events back at least 2 weeks to try to see if they can get past a peak or curve of the current COVID Delta variant spreading throughout the community. Most of the people in the hospitals are unvaccinated, and they tend to be younger, in the 20s, 30s, and 40s, rather than the original influx of patients that happened about 18 months ago, which were usually in their 60s, 70s, and 80s. So we're starting to see younger patients, we're starting to see them sicker, and we're starting to see them in the hospitals. As of last week, the entire health district between the 3 hospitals, Stafford Hospital Center, Mary Washington Healthcare, and Spotsylvania Regional Medical Center, were averaging over 100 patients per day. So that is quite an increase from what we had just 2 to 3 months ago when we were down in the teens and 20s. So the biggest thing that we can emphasize now is, again, getting the vaccine. The vaccines are available. They are able to be gotten fairly readily. Testing is also available. If you feel sick and you're not quite sure what symptoms you have, by all means go get a COVID-19 test. A PCR test is the best way to go. But we certainly recommend that and the vaccines. The latest news on vaccines as of this week: Johnson & Johnson, the one-shot dose that you've had and seen in the past, they're going for FDA approval for a booster shot. Pfizer has already gotten approval of a booster shot for those people that are immunocompromised or over 65 years of age. Moderna has still not gotten their paperwork done through the FDA for a booster shot at this point. There is still some contention about that, but again, the idea is if you can get the vaccines, it protects you that much better. Doesn't guarantee you won't get COVID, but it certainly does go a long way to relieving the potential of possibly getting it and also making it less severe if you do get it. We'll talk again next week. Thank you.